We're going to talk about high blood pressure and really what blood pressure is. And because of the fact that I've had so many of my patients um, really ask me to explain it to other people because of the fact that what I tell them is so different than anything that they've ever heard and really can make a huge, huge, huge difference in your life. And first thing I would like to say that standard disclaimer, this information does not constitute medical advice, and there's a full disclaimer at the end of this video. But let me just go through why it is that I always say that and you have to understand what blood pressure is and the information that you're being told. We'll put it this way, it's going to be a lot different what I'm going to tell you right now. So let's just get right into this. And we have to say, what's the purpose of blood? And the purpose, of course, is to bring life to the body. It's going to bring oxygenation through the red blood cells. It's going to bring the food and all the nutrients, the electrical energy. It also helps remove waste and byproducts from the cells. There's cellular communications from the hormones and the peptides. There's immunity and defense with the white blood cells and the T cells, monocytes, macrophages, beta cells. There's the repair through things like growth factors, cytokines, cholesterol, fibrinogens. And then there's the ability to maintain homeostasis. It helps maintain your body temperature. That's why you'll have things like the blood vessels will dilate to take down the temperature. So you have a lot of different things that are going on. But let's just get right into some other things with blood pressure, because blood pressure changes upon your needs. So whatever your needs are, it's going to adapt the blood pressure. So while you're sleeping, your blood pressure is much, much lower than when you're awake. And then if you're exercising, of course, what happens? Your muscles need more oxygenation. They need more nutrients. This oxygenation is so your blood pressure goes up to bring more blood to those muscles. And by the way, what controls a lot of that is the parasympathetic nervous system and the sympathetic nervous system. You hear that fight or flight. So with sympathetic nervous system, blood pressure is going to go up. You're going to send more blood to the muscles, but less to the digestive system, for instance. And the parasympathetic system, of course, helps slow this stuff down. So meditation is going to decrease your blood pressure. So here's the key. I want you to remember this. And the first thing when you see this, you're going to say, well, of course this is true. And that is that your blood pressure rises and lowers according to the needs and the demands. But so here's the thing. If your blood is thicker, such as diabetes, it's going to raise the blood pressure. If you have a low redox potential, it's going to raise, you're going to have a higher blood pressure. If you have kidney damage, and just think of this, if your kidney is the filter. If you have a filter and it's getting gunk all into it and it's blocked, if you have like water going through that filter, now you don't have as much water going through. So if you increase that pressure, now you can sort of compensate for that filter not functioning as well. So the body's smart. And that's the thing you have to realize. The body is smart and it compensates for this. So, and this is, I'm going to give you something that's going to really blow your mind on this. If you haven't heard, if you're not familiar with it, and that is the Heinki Study. And that's the Heinki Businessmen Study. And it was a group of businessmen. They did this in Helsinki, but also throughout Finland, back in the 1964, from 1964 to 1973. It's a very large cohort. There was 3,490 male executives, and they supplied free care on this, as far as like they would check them out, and they would go through, and then they divided them off into two different groups, the control group and the active group. And they looked at different risk factors. So they're looking at things like BMI, cholesterol, triglycerides, blood pressure, blood glucose level, smoking, and resting and non-resting ECG, the electrocardiogram. And here's the thing that's amazing about this study. So they followed up and they did a study. They did it in 5 years. And so here's what I should say. So on the one group, they interceded. And so what they did was, if a person had high cholesterol, they put them on cholesterol medication, they lowered that cholesterol. If they had high blood pressure, put them on high blood pressure medication and lowered that blood pressure into that normal range. Triglycerides, if you had high triglycerides, you lower that. All of the group was given some dietary recommendations, and they're basically told some some typical stuff. But the one group was the active group that they really actively managed these different biometrics. Here's what the surprising part was. Both the all-cause mortality, and particularly in CVD and cardiovascular disease, the group that was the active group that they would intercede in and lower, they would take an active role into correcting those out of range markers. They had a lower mortality. In other words, they had a higher death rate. So when they first did it 5 years, you think, well, things can happen in 5 years. There's a lot of people there's a number of people who died, but those numbers are minimal. Let's take a look at it in 10 years, 15 years. It just kept getting worse. The same thing happened. They've done this now, and most of these people, I know back in 2015, I think the oldest person was 96. So they're probably, and this is a case study that people have gone back and looked at this. They've looked at 50 years of data. 50 years of data. And what they found was, and particularly, for instance, in the heart failure rate, those with lower blood pressure, the people with high blood pressure had a much, much better rate of success of surviving than those with lower blood pressure. And again, what did we say? Blood pressure rises and falls according to the adaptation of the demands. So when the demand is higher, it rises. When it's lower, it falls. So when somebody has a heart failure and the heart's not functioning, well, if the blood pressure rises, they can get the blood to these areas. See, if they have kidney disease, if the blood pressure rises, the body will try to protect, for instance, areas like the brain. So when, and all these things, what you have to say is, think of it this way. It's like a fever. The body is smart. Symptoms are good. Is a fever a good symptom to have? Well, you shouldn't always have a fever. That's not normal. But if you have a bacterial or a microbial infection, that could be very normal to have a fever. So what does the body do? It works like crazy to raise the temperature. Why does it do that? Because it makes a temperature where we can live and the microorganisms cannot. By raising this temperature, you're speeding the reactions of the body. You're speeding the, macrophages, monocytes, T cells, beta cells, all these different immune factors. As you raise the temperature, that metabolism rises. It speeds these reactions up. The body is smart. Symptoms are good. So when you start to take a look at this blood pressure, it's not just, hey, take a blood pressure medication and lower this. And you'll hear people say, hey, you have a lot of high blood pressure. You need to lower the blood pressure. And by the way, I am a natural health practitioner. I don't take people off of medications, don't put people on medications. What we do is take a look at the problem and say, how can we correct this? What do we need to do to correct it? Okay, so with blood pressure, what are some of the things that you can do? And then, by the way, And I forgot, we just wanted to go through this real quick. When we talk about these, like using medications, here's some just stats. Blood pressure medications increase diabetes by up to 50%. Non-steroidal anti-inflammatories can cause 20% of all heart failures and can cause high blood pressure. They actually increase the risk of heart failure by 10 times. That's not me saying it. That's the research saying it. All right. So, you look at, there's a study from the Archives of Internal Medicine, and it looked at 80,000 women. And what they found was that those who took non-steroidal anti-inflammatories for 22 days of the month or more, they had an 86% greater risk of high blood pressure. Obesity. In fact, obesity may be one of the primary predictors of high blood pressure. And one of the things about that is, for every extra pound of fat, your body has to actually create 5 more miles of blood vessels, primarily capillaries. Okay, so you have to push through that 5 miles of extra for every pound. 5 miles. But people always ask me, well, doc, shouldn't we take aspirin to thin the blood? Now, here's the thing. Do you think that our Creator did this, God created this body with this, magnificently. And except he messed up one thing. Our blood's just too thick. If we just had thinner blood, we'd be like right on. Yeah, you'll hear doctors say everybody should be on an aspirin. We want to thin everybody's blood. Yet we know that aspirin, damages the lining of the stomach, damages kidneys. And the reality of it is, we see what it does for heart failure. If you want thinner blood, it's really easy. Most of the time, people aren't drinking enough water. They're dehydrated. You need fluid. You need water. All right. So let me just go through, and we're going to take a look at some of the things that we can do. So what is blood pressure? Well, there's the systolic and the diastolic. The systolic is the top number. That's the pressure to pump the blood through the circulatory tree. The diastolic is the bottom number. That's the pressure to pump blood through the heart. So to improve your blood pressure, what do we need to do? Number one is you want to improve redox potential. This is truly important. I have a whole video on redox, improving redox potential. Recommend that you watch it, because it's going to help with every aspect of your life. We tell people that anyone who starts a weight loss program, for instance, we say, hey, you need to have healthy redox. If your redox potential is low, you can have more. You can have challenges, and you don't need to. Just bring up the redox. If your leptin sensitivity, you improve leptin sensitivity. Leptin is the energy accounting hormone, basically. Its job is to manage, direct, and control energy. They used to say it was involved with the fat burning hormone. It's about energy. Part of that energy is about fat. It's about the thyroid. It's about the adrenal gland. So it's about energy. Pain medications can cause high blood pressure. We talked about that earlier. Coffee and caffeine, you want to remove that from your diet. There's foods that you can eat. We're going to go through that, because we're going to take a look at, we use Food Pharmacy, which is, I was the developer of the SaaS version of Food Pharmacy, which is just incredible. Now, we use hydromolecular to assist the free flow of protons and electrons. You want to hydrate the cells. In our office, we use 2 teaspoons of Circumost in 24 ounces of water and sip that all day. There is some thought that this may also support the body against nanobacteria. Nanobacteria, also called self-replicating calcific nanoparticles, that has also been implicated in a number of conditions, including kidney stones, including heart valve challenges. So it's but we're very, we really love the product, Circumost. And you want to improve your Zeta Potential. and to improve zeta potential. And by the way, let me just go through. Let me go through what zeta potential actually is. Okay, your zeta potential is blood. Things aren't dissolved in the blood; they are held in suspension in the blood. So it is a colloidal system, and the zeta potential is the electrical charge within that system. And if that system has a great electrical charge, then it's going to function properly. If that electrical charge is off, then you're going to have some challenge. So it's really all about maintaining the fluid dynamics of this electrical charge of this system, this colloidal system. So let me just go through this. It's about fluid dynamics. It's the electrodynamics and the electrical mechanical functions of water. So when we take a look at the proper blood flow requires an optimal electrical charge. And this electrical charge is called the zeta potential. And all living systems operate between a negative 15 to a negative 100 millivolt of charge. So when you lose the zeta potential, when you lose that charge, things fall out of suspension. And by the way, this is fluid dynamics throughout anywhere in the body. I want you to think of this. If a tree, think of a tree it could be a 100-foot tree. There's no heart in the tree. Yet the water goes from the roots all the way to the top of the tree and all the way out. How does it do that? It does that using the zeta potential. It does that with an electrical charge. And by the way, you can see that even in, just get a glass of water. And what you need to do is put a clear straw in the water. Just stick it in the water. And notice where the water is in the straw and where the water is in the glass. And you'll notice that the water in the straw, the water goes up higher in the straw than it does in the glass. And if you may get a thinner straw and do it, it'll actually go up a little bit higher. And it's this electrical adherence. It's this electrical potential that's within that water. All right. So the fluid dynamics is just amazing. When something falls out of fluid dynamics, for instance, the common bile duct that goes from the gallbladder and the liver to the gut. If you don't have good fluid dynamics, you can get that thicker and start blocking up, and you don't get this proper movement of the different fluids. And that is the zeta potential. And so the zeta potential, you can see anything that's like if it's more than 61, that's excellent stability. You start to get 40 to 60, it's good. 30 to 40, moderate stability. 10 to 30, that's incipient instability. You have instability there. 0 to 5, that's rapid coagulation or flocculation. And what we know is things like aluminum, for instance, can cause that tremendously. And that's why you'll have, they'll use different items and materials if somebody's bleeding, you put it on the butt and it'll cause it to clot fast. It'll cause that, because it causes rapid coagulation or flocculation. And so this is truly important within the body. So some of the things you can do, like we said, that's why grounding is so important. The Earth is the largest amount of surface electrons. You also have make sure you're getting more photons and electrons through the sun. First thing in the morning, open the door, go outside in the bare feet, face the east in the morning. That helps you with your circadian, first thing you do, it helps you establish your circadian rhythm, which is another very important aspect of all of this. It allows you to get the surface electrons. Remember, there are foods that you can do. So let's take a look at food pharmacy. Okay, here we are logged in to food pharmacy. And one of the things we can do, if we jump right down, we can go into our conditions and challenges, and it makes it real easy. We just go to hypertension, and we find hypertension and check that. Now, the nice thing about this is, so a lot of people have hypertension, but it's putting hypertension combined with everything else. So it's one thing to tell someone what to do with hypertension, which we'll go through that and show you what we'd say. And by the way, before we even let me just show you a couple of things. So you click that, we can get a report, but we can even go into the patient detail list, and we scroll down to hypertension. It's the only one that we have on here, so this is pretty easy. And we can see that this is an abnormally high pressure on the walls of the blood vessels. Blood pressure is based on 4 factors: blood output from the heart, resistance to the blood flow, the volume of blood, the distribution to the organs and tissues. These 4 factors can be affected by a number of parameters in regards to hypertension, including poor Zeta potential, infection, inelasticity of blood vessels, nerves, or hormone imbalance or response, or weak kidneys. So these are some lifestyle modifications, and this is all built in. And the nice thing is that the practitioner can modify these. These are the standard ones that are built into right now. It's important to get blood pressure under control. For each 20 millimeters of mercury systolic and over 10 diastolic increase in blood pressure, that doubles the risk of death from a cardiovascular event. So you want to get this under control. Now, grounding is important to improve the Zeta potential as well as to improve endocrine balance. Obesity is a strong predictor of hypertension. Losing weight, even 10 pounds, greatly reduces your risk of hypertension. Follow your food plan precisely. Light or moderate physical exercise without overexerting. Avoid artificial sweeteners that contain phenylalanine, such as Equal and NutraSweet. Be certain to get adequate, high-quality sleep. Avoid stress as much as possible. Be certain to get adequate, high-quality sleep. Let your eyes get exposure to sunshine without looking through glass immediately upon awakening to help set the circadian rhythm. Monitor your blood pressure at home with a home blood pressure monitor. Some of the predisposing factors: stress, smoking, endocrine hyperfunction, obesity, lack of exercise, renal dysfunction, liver portal congestion, type 2 diabetes, atherosclerosis and arteriosclerosis, excess caffeine or sodium intake. Selecting this option is going to increase items that are known to be beneficial for this condition. It's going to increase calcium, vitamin D, omega-3 fatty acids, foods high in arginine, high sodium content foods, sunflower seed oil. It'll decrease dairy foods, fructose, and alcohol. And it gives the reference to for all of this, and so you have that. Now, let's just go out of here. I'm going to go back, and one of the things I'm going to go to is the allergies, intolerances, toxins. I always use this one here. We take out foods that are carcinogens, harmful fats, mercury-contaminated foods, refined sugars, synthetic foods, and then we can finish this. And by the way, you have a lot of different options that we can pick on this. But as far as for what we're going through, that's all we're going to put on, and we can print this out, and then we get to see the green are the ideal foods, the black are neutral foods. So they're not going to have an effect much one way or another. The italics are going to be cautionary foods, so you only want to eat those rarely. And then the red you really want to avoid with this condition. And you can see what it does. It takes out, there's certain seafoods that were taken out. There's a lot of the certain dairy that was completely taken out. We took out corn and olives, cottonseed oil, margarine, canola oil is one that you shouldn't eat. But you get to know which are the best fruits and vegetables. For instance, even like alfalfa sprouts, typically they're good. But in this case, with high blood pressure, we're going to eliminate them. You're going to be better with almost every other green except for the sprouts and the alfalfa sprouts. So you take a look at this and you get to see what are the foods that are going to be better for me and which are not going to be good. And then you combine this. If you have other conditions, you start to build up on this. Like I said, it really becomes incredible. The ability that you can actually take a health challenge and find exactly what's going to help your body. So I hope this helps you understand high blood pressure, what you need to do about it, and really think about that Heinki businessman study, because when they corrected high blood pressure for certain things, and I'm not saying to get off your blood pressure medication, but just understand the information. Our full disclaimer: the information provided is for educational purposes only and is not medical advice. The statements made or the opinions of the participants have not been evaluated by the Food and Drug Administration. By providing this information, we are not diagnosing, treating, curing, mitigating, or preventing any type of disease or medical condition. This is not intended as a substitute for professional advice of any kind. Before beginning any type of natural, integrative, or conventional treatment regimen, it is advisable to seek the advice of a licensed healthcare professional. Our full disclaimer can be found at Wellness Technologies.ai /disclaimer.